In terms of what happens, like the agenda is going to be the same. As we talked about, the tools are all the same. The surveyors will be working off those tools and providing them to the organizations. It's just a change of the existing process, right? Because we're still doing the survey process. We're still evaluating all of our life safety features and the physical environment features of the buildings, and we'll be scoring the same things, but they're just going to go into a new location now.
There's a major crisis facing healthcare facilities management. We have aging employees, aging buildings, and aging infrastructure. We've created the Healthcare Facilities Network, a content network designed specifically to help solve for these three pressing issues in healthcare facilities management. We bring on thought leaders and experts from across healthcare facilities management, all the way from the C-suite to the technician level, because at the end of the day, we're all invested in solving the aging issue. Thanks for tuning in. Look at our videos. You will find that as a theme across our content. This is the Healthcare Facilities Network. I'm your host, Peter Martin.
For those of you who do not know, Jim is Field Director in the Division of Accreditation and Certification Operations at the Joint Commission. No, at Joint Commission, right, Jim? The is gone.
Correct.
Okay, at Joint Commission. That'll be a while. I mean, if you think about it, people are still saying JACO after how many years, so that the is going to hang around for a while.
Probably.
But anyways, if you take anything from this, get rid of the. In Jim's role, though, he manages and supports Joint Commission Life Safety Code surveyors, implements and evaluates the accreditation survey process and performance, and serves as a faculty for educational programs throughout the United States. Jim, what else did I miss?
So a quick background on my healthcare experience. So I worked for about a decade in the Midwest here. I worked for an organization called Advocate Health, which has kind of changed names a few times since. They've gone through some mergers and joiners. But I'm located out here in the Chicagoland suburbs area. I started out in healthcare as a facilities mechanic, where I got to experience all the life safety features and do all the inspection, testing, maintenance that I now get to survey to. I worked my way up through that system, got into safety management, where I was an environmental care committee chair, also was on our quality management oversight committee. And then I moved my way up to manage one of those sites that I was overseeing from the safety perspective as in the facilities management team at we'll say a medium-sized hospital. It wasn't small, but it also wasn't big. So that's my experience before then coming over to the Joint Commission, where I started off in the standards interpretation group. And then this year I jumped in to join the field director team.
Awesome, Jim. So people may have seen Jim before. He's been on our Millennial Roundtable group. But it's funny, as you were talking, Jim, I was thinking, I think we met in 2014 and you were literally still a technician.
Correct.
Kind of starting out. And now what? Coming up on 12 years later. It's really kind of a testament to, obviously, your work ethic, your ability, but also kind of this healthcare career where you're passionate about what you do. Yes. Where there's opportunity if you are passionate and want to move up and make a difference. It's a tremendous path.
There's also some great networking and tools and resources out there. A shout out to all the local and regional ASHE societies out there, which I now have the pleasure to go talk at. But I was a part of HESNE, the Northern Illinois Engineering Society, which had wonderful resources and was a great networking group, and a lot of individuals there that I keep in touch with to today. Those things, I can't shout their praises enough in terms of providing courses, education, opportunities to go survey hospitals, or I should say audit hospitals and look at processes. So, I try to use as many of those as possible to help provide me with resources along the way. And yes, also just being kind of motivated to also get into it and being very passionate about life safety. Yeah, no, we certainly are. And so that brings us to, the topic for today's conversation is Accreditation 360. So why don't we just start right there? Jim, what is Accreditation 360? Accreditation 360 is Joint Commission's new accreditation process, where we are revamping all of our standards, or as we usually call it, the accreditation manuals, that apply to the hospital and the critical access hospital programs. And we have a lot of others, but these are the two that we're rolling this out for in 2026. It's a new consolidated, simplified accreditation manual, with the goal being to align the Joint Commission standards with CMS's state operations manual and the conditions of participation that accredited organizations that receive reimbursement from the Centers for Medicare and Medicaid Services provide. So that is, in a nutshell, what it is.
So you mentioned conditions of participation. Are conditions of participation changing?
The COPs, or conditions of participation, are not changing.
Okay. And when does Accreditation 360 go into effect?
January 1st, 2026.
January 1st, 2026.
For the hospital and critical access hospital program specifically.
Yeah, very important, right? Hospitals
Yes.
and critical access hospitals.
Correct.
So is the survey process changing, Jim?
No. So that is the critical part of all this. So for organizations who might have some anxiety about an upcoming survey, let's say they've got one coming up in 2026, what we'd like to emphasize to you is the survey process you went through, let's say 3 years ago, with all of our survey activity guide, which is turning into the survey process guide, which we might get a chance to talk about later on in this call. The tools that we provide, like the document review tool, the buildings survey tour tool, the kitchen tracer tool. There's probably some others I'm forgetting, but all these tools that we have used and shared with organizations over the years to provide the survey process or the survey scope, none of that is changing with this. For the Life Safety Code Surveyor survey process, what's changing is really the nomenclature and the standards that we're using to then score items that we might find out of compliance during the survey process.
What's the goal of A3 or Accreditation 360? I think you guys are calling it what, A360?
Yeah, A360.
Just to shorten it?
Yeah, so the goal is really, it is a consolidation and a unification with the COPs. So if you looked at for example, if you looked at the current accreditation manual, the way it's listed is it has the COPs, and then you have all the standards underneath them that you'd have to follow. Now, when we say standards, it's probably pretty important for me to flush out the different types of standards out there. Like CMS has their standards, which they call K-tags, which there's 130 some odd K-tags, which are all based on Life Safety and Healthcare Facilities Code and the State Operations Manual. Then you have Joint Commission. We have our standards, which we call the Standards and Elements Performance, or EPs. And so there's a lot of what you would say, I call it like overlapping of interpretation on requirements. And what we're doing with Accreditation 360 is we're trying to simplify the Joint Commission standards so they're better aligned with what CMS's requirements are. So instead of having all these different layers of interpretation on what's required, we're trying to simplify and unify it and align it with what those requirements are from CMS. Because at the end of the day, that's what we're accredited organizations are required to follow, is CMS's conditions of participation.
One of the big headlines out of A360 is the reduction in standards and the reduction in EPs. And I just, we'll roll these numbers by you. So current state, life safety, 23 standards, 260 EPs. On the EC side, 21 standards, roughly 190 plus EPs. In the future state, beginning January 1st, 2026, that's under, we're calling it the PE, correct?
Yeah, physical environment standard, yes.
So the physical environment standard, so the LS, the EC, they go away. It's the physical environment standard, comes down to, is reduced to 12 total standards and just about 67 EPs. So a significant reduction in both standards and EPs into this one thing, which we're calling the PE.
Yeah, if you go through one of our A360 presentations, they'll talk about, for the hospital program, I think they say it's a 48% total reduction of all standards and EPs and 46 for critical access. But for life safety, it's actually closer to like 75%. So we definitely had more of an alignment than some of the other chapters of our standards.
So what's like the practical implication of this reduction?
Well, I'm going to speak from that specifically from the life safety code perspective, because that's obviously where my wheelhouse is. The scope isn't really changing at all. And that's why, at the outset of this, we kind of talked about the survey process isn't changing. And then the reason for that is because if you think about what organizations are required to follow, the codes, which for us is the National Fire Protection Association, NFPA, 101 and 99, the Life Safety Code and Healthcare Facilities Code, respectively, are required to be followed per the conditions of participation of CMS. That's not changing. The codes haven't changed. The adopted version, which we follow 2012 right now, because that's what's been adopted by the Federal Register. It's actually in federal law. It requires an act of Congress to actually enact a new version of and adopt a new version of a code. Yeah. And that is not happening as of this time. So that's why, from a survey scope and the expectations for life safety compliance, there's really no change because the code's not changing. The COPs aren't changing. There are some small tweaks happening to this, the state operations manual, but it's really more of I would say, they're detail-oriented changes to try and provide better understandings of the scope. And Joint Commission is looking into those and how they might apply. And I know that's kind of like on the front of everyone's mind right now, but I've done a rough overview of them, and we'll see if there's going to be changes that come. But as of right now, because everything that we're doing here with the Accreditation 360 was reviewed and approved by CMS, there's going to be no changes to what we're actually evaluating.
With the reduction in standards and the reduction in EPs, folks are worried that kind of the guardrails are gone, right? Sometimes if you have more proscriptive, it's just easier to know and prepare for. With those removed, I've heard some folks out in the field, and again, obviously it's based on their experience as opposed to what they're experiencing because it's not taking place yet, but they're a little bit more concerned that theoretically there could be more high risk findings under the new survey not new survey process, but under let's just call it the PE, the physical environment.
Because the requirements aren't changing, really, and we aren't re-educating surveyors on changing our process, right? Because I already talked about how the process isn't changing. So the only thing that's like the tools, if you go onto our website right now, you can actually look at the survey process guide, which is our new reformatted version of our survey activity guide, which hopefully our organizations are familiar with, that you have access to now. Anyone can actually go onto our website right now and download the survey process guide, which is our updated manual. It goes into step-by-step detail of what the expectations of the survey process are. And from the life safety code perspective, all we have done is essentially use the existing formats of our tools and our survey guidance, and we've changed the nomenclature to reflect the new standards. But if you look, like the document review tool is probably, I think, the best example because everyone's probably very familiar with it. We provide it on survey. The surveyors use it as their tool to complete the survey process. I've been teaching base camps for years, and I always show examples of it and how you can use it. Literally, the order of the document is staying exactly the same. The only thing that's changing is instead of EC 235, it says PE 311 EP3. So it's just the nomenclature and the standards that are changing. But what we're doing, what we're evaluating, none of that's changing. So there shouldn't be any, and I'll try to use a term I think is applicable to all of our facilities people, no scope creep that's happening with this, right? And we're still, and I'm one of the people who's responsible for training the surveyors. We are not changing our survey process. We make tweaks, as things get clarified, as we get maybe advice from CMS, or maybe if there's updates to interpretation on things. Of course, there's micro changes. They happen all the time. And we try to communicate those out to the field via our periodicals that we provide, like Perspectives and EC News. But in terms of substantial changes to survey process, none of that is happening with Accreditation 360. And so to the second part of your question about, is it going to make findings look higher risk or change the way they're evaluated? No. We use the SAFER matrix to try and determine the scope. We call it the manner and degree of a finding. That is, we evaluate two things. What's the risk? Is it low, moderate, or high? Which is based on the likelihood that this non-compliant issue could cause harm to a patient, staff, or a visitor. And then we have the manner. The manner is the quantification of the finding. Is this something that's happening pervasively across the organization? Have we identified the same issue in various areas? To give you some context, if you're evaluating smoke compartments and we find issues with smoke barriers, if we find it in one smoke barrier in one compartment in a building that has 20 compartments, well, that's a limited scope because it's only impacting a very small part of the hospital. Now, if we find there's penetrations in every single smoke barrier throughout every single smoke compartment, well, now you've got what we call a widespread issue because it's pervasive across the campus. And that is what we use to drive the risk levels of findings. So the way we evaluate findings is not changing either. We still use the manner and degree based on the risk and the pervasiveness of the issue to determine how high risk or where something's placed on the safer matrix.
From a facilities perspective, what should organizations be doing now? I know you talked about I know you have a lot of tools on the Joint Commission website, so certainly on the Joint Commission website, so certainly touch on that. But what else, if they're expecting that they're within the first 6 months of 2026, what would you suggest they do?
So a few things. First of all, we have a number of documents that we have provided as resources for Accreditation 360. And again, these are available to everybody that is able to access our website. You don't have to be logged in or anything like that, or even be a customer. You can activate these resources. So, and we also have some new resources that we've been releasing along with this. So I'll try to touch on these. Let's go in order of what I think is most helpful. First of all, in September, we started releasing webinars for all the new standard chapters for Accreditation 360. And PE, which we've talked about, physical environment, and National Performance Goals, NPG, which is another one of our new standards that does have some of our old EC standards rolled into it. There are webinars that specifically cover those chapters, what those chapters involve, and how they were crosswalked from our old stuff. And I'm talking more about the PE webinar for right now. So these webinars are free. All you have to do is go to our website, go to browse webinars, and it'll give you a list of all the ones. There are more coming, but really the two for our facilities people are going to be the PE and the NPG are the ones I'd encourage. They're not too long. I think they're about 25, 30 minutes in length. I've gone through them recently. I've gone through them a couple times. I think they're very helpful. So that's where I'd start, is watch those webinars that are free and accessible to everybody out in the public. And then we have our what we call pre-publication resources. These are 5 guides that have been released they came out on July 1st when we announced Accreditation 360. Sorry, I think it was it was July 1st. It came out 360. We've been updating them as we've gotten some constructive feedback or if we've found any errors. These documents are very long. I want to preface that. Like, for example, the survey process guide, which I already talked about, is 600 some odd pages long. Wow. So these are hefty documents. And there's a lot to them. And I want to stress that all of them are PDF documents that you can use Control F and search. And I highly encourage doing that way to be efficient. If you go in, you want to know, well, what are the physical environment requirements in the survey process guide? Well, go in, Control F, search physical environment, and away you go. I do think the survey process guide is probably I'm going to put it in third place after the webinar, a document that I think everyone should be looking at, specifically because I want people to be aware of the survey guidance tools that we have in there, which are at the end of the document, but there's a table of contents that you can search at the beginning so you know which pages, and or you can search them using Control F, as I just mentioned. But the document review, document review tool, the building survey tool, the kitchen tracer tool, the emergency management tool, these are all things that are there I think people should be looking at. They're there. They look exactly the same as they used to, with the exception of they have the new standards on them. So anyone ask me if what do you do for survey readiness? Right there, look at that survey process guide. Look at what falls under PE requirements and NPG and be prepared for that. It's an open book test. For those looking for more specific Accreditation 360 guidance on how the standards are changing from EC to LS, I would recommend they look at the disposition report, which is the second most important document, I'd say, of the three I've talked about so far. This document shows you, it's in alphabetical order of the standards. And what it does is it shows you a list of the existing standards as of 2025. So again, you could search EC or LS, and you get the list, and they are in order, so you don't have to it's not jumping around. You'll show you what the standard was, what the EP text was for it, and then it'll tell you what the disposition of it was, which is what happened to it in Accreditation 360. And you'll see it was either deleted, it was moved, it was split, or it was revised. And sometimes you might have more than one of those applying. If it was deleted, that was what we most likely determined is it was either redundant, maybe that was covered by another EP. I can tell you in EC and LS, there were redundant standards in EPs where that you could easily say that they were for more than one topic could have fallen underneath them that had another location that would have been just as appropriate. I know that because of my time in SIG. And then it also might not be considered a requirement that Joint Commission determined is something that we aren't going to keep inside of scope. So if it wasn't required by code, or if it wasn't required by the State Operations Manual or the COPs, and we determined that we didn't want to make that a necessary requirement, it might have been deleted. Alternatively, most of them probably got moved or split because they were probably consolidated. As we saw, we did quite a bit of reduction. Some of them were revised, which means, like for example, some of the moved and revised applies to a lot of our interim life safety measure or the ILSMs. Those exist right now at LS 121, and then there's 15 EPs. Those are going to be now under PE. Well, I think it's 321. I think is all the ILSM requirements, and the EPs are still there. It's still 15 EPs, but they did clarify the language a little bit and revised it. So those say moved and revised, for example. And then you've got some that got split where maybe they had a leadership implication, but maybe they had another implication, so it got split into two standards. And I'll tell you, most of the ones that happened to did have either an EM portion or a leadership portion, so it kind of got split into two other different standards.
So these are my words, not yours. So the disposition report, like if there's a director out there, or just somebody out there who wants to see where everything went, they don't like you're talking about the guides, the 600 pages, but if they want to look at Cliff Notes, dive into that part before they get into the meat and potatoes. It almost seems like the disposition report is kind of that map for you, and then you dive into it and dig if you want to know where things went.
Yes, I think if you're someone who's familiar with the process, has a relatively good comfort with the standards, and you just want to know what are the new standards, disposition report is my starting point for you. Yes.
So that's like a nice cheat sheet.
And it's only 300 pages.
That's better than
you have to remember, so there's a lot of standards. I mean, of those 300 pages, probably, if I had to take a rough estimate, 40 or 50 are for PE and MPG, which are the new from our old ECLS standards. So I mean, remember, there were 44 ECLS standards. So you got 44 items to cover. I think that's about 40 pages of items that have to get covered for ECLS, showing how they're being transposed into physical environment and NPG.
So I've heard you and your colleague, your field director colleague, Tim Markajon, I don't envy the two of you as you approach January 1st, talk a lot about kind of crosswalks between the old and the new. Is the disposition report one of those crosswalks?
Yes, I would call it a crosswalk because it shows you old, and it shows you, or existing, and it shows you new state. We also have two crosswalk tools that you can use as well. Again, I think the disposition shows it better than any of the pages, but there's also one that's called the Crosswalk Compare Report.
Compare.
Yeah. It's on that pre-publication website tool, so it's with the disposition report and the accreditation manual and the survey process guides that are available to everyone online. It shows you a list of the COPs, the conditions of participation. So it's in order of the COPs, and then it shows you what are the existing standards that fall under those COPs, what were the EPs under them, and then it shows you what are the new standards that would then fall under the COPs. So I think that one's a little bit clunkier to use, but it's still, I think, very important. I mean, I'll be honest, I keep all these documents open all the time, so I'm referring to them constantly. Just like when I was in SIG, I was always referring to Edition, which has all the current standards and things like that. So, we try to provide almost more resources than you might be able to possibly use, but I do think they have very specific uses that they can be very helpful for. So it's probably a good idea just glance over all of them, see which one helps represent the information best to you.
If you like this video, please like and subscribe to the network. And more importantly, share it with your colleagues in the healthcare industry. Together, we can solve the aging crisis that's impacting all of us.
The national performance goals. Can you talk
Yeah.
a little? You know, you hear a lot about the new PE standards,
Yes.
right? But the NPG's a little bit less. What are the national performance goals? What are the elements?
So there's quite a few, and I'm going to be honest. I'm going to pull up a cheat sheet here to help me
Sure.
with NPG because
You got a lot going on.
it's got a lot of scope. It's a very big chapter. So, kind of a summation is if you're looking at our current standards, you'll see that we have the National Performance or National Patient Safety Goals, NPSG. That standard is actually going away, and it had a lot of clinical elements built into it about patients' rights, patient safety, and things like that. When we revamped the physical environment or the ECLS standards into the physical environment, we realized there are some things that are not required by code, also not required by conditions of participation. Some of them have requirements by state and local authorities, or some federal requirements like OSHA, for example, or maybe the EPA. So for those where they don't necessarily have a code or a COP direct requirement, moved and revised and put into the National Performance Goal chapter, which you can kind of think of it as a Joint Commission specific requirement chapter.
Huh.
Yeah, that's how I try to think about it, but it has a lot of elements built into it.
So if you say a Joint Commission specific, that would mean something that perhaps the DNV doesn't have. It's unique to the Joint Commission.
I can't comment on what other organizations' requirements are because I'll be honest, I don't know all of them off the top of my head.
Sure.
But they are yes, Joint Commission specific because maybe they aren't required by other AHJs, for example, which AHJs is authorities having jurisdiction, which there's lots of layers of that goes into play too for a lot of organizations. So the kind of the scope is for national performance goals is it covers culture of safety, there's emergency management portions. So and I want to mention that to say that we still have the EM chapter, the emergency management chapter that was revised about 3 years ago. It still is remaining. However, some parts have been plucked out, usually because they have some sort of leadership involvement or a committee involvement, and got put into national performance goals. There's also healthcare equities covered here. There's some infection prevention control requirements, pain management. These are obviously clinically based. Patient rights, I mentioned before, is here. There's also our suicide risk reduction requirements. So this was built into our national patient safety goals previously and has been transposed over into physical environment. That does have a life safety codes element to it because we do evaluate the environmental risk assessments if organizations have dedicated behavioral health departments or units. So we would evaluate their environmental risk assessment, if they have high-risk patients that they're overseeing, and make sure that they're following what their mitigation strategies are in place for those areas. Wave testing, workplace and patient safety is here. So our old EC 211 security and safety requirements now fall under NPG, which I think does make sense. If you think about it, those aren't required by code per se. Those are kind of things that are above and beyond. There are some authorities having jurisdiction that might have requirements regarding that, but that's where that lives now. Workplace violence is covered under this as well. That's a CMS requirement, yes, but does fall under national performance goals. Staffing requirements are covered here. And finally, imaging safety and medication management. Now, obviously, imaging safety does have some life safety code Surveyor implications because we evaluate the mitigation strategies and policies, procedures for radiation safety and nuclear medicine safety, for example. So MRIs as well, right? We have to have policies and control measures in place for our MRI machines due to the serious safety risks that can be involved with those. That's kind of an overview of what NPG.
So there's some familiar elements within NPG.
Yes.
It shouldn't be completely new to folks.
Right, because again, the process isn't changing. So the things that we review, the things that we evaluate, none of that's changing. It's just been moved. It's been kind of put into a new living spot for how we're going to score it and not evaluate it, but just how we're going to score it.
So you said, I think staffing levels within it. And as you know, I mean, kind of like staffing levels, recruitment, competency, it's all near and dear to, to me and what I do and what we continue to do. Is there anything, Jim, those competency assessments that you folks do, are they, and I should have looked, are they included in the MPG, or what about staffing levels is in there?
Competency and training is what is covered under there. So yes,
Okay.
that would fall under that purview there. So yes, we're still going to be doing the same process of evaluating the facilities leadership teams, making sure that they have the organizations have a job description, and that they have the people that are in place for those positions meet the requirements that the organization has determined they want to have for those individuals.
I used to, like I said, I used to do the recruiting. I would see, and I wonder, as we go forward, bringing more people in who don't necessarily have healthcare experience. I mean, it's just a fact. You guys don't control it. I don't control it. Organizations are bringing folks in who do not have healthcare experience. It's probably important. And again, I know you can't tell hospitals what to do, so this is probably just me talking, but that job description becomes very important because that's what you're measuring the organization against, right? You're not telling them what that job description is. They're telling you, and you're ensuring that they're hitting that. Is that accurate?
That is accurate, yes. So organizations kind of set their own expectations for individuals that are coming into those roles, and then we evaluate that those individuals are meeting that criteria. So we ask the organizations, provide the documentation to validate that if you said this individual is going to have a certified healthcare facilities manager certificate and have a college degree because your job description says those are required, then we'd want to see documentation that shows that individual in that role has those requirements in place.
Let's talk about ASCs. We talked about hospitals, acute care hospitals, critical access. Mm-hmm. Where do ASCs fall within the new survey process? And are there not differentiators, but how do we define different ASCs, I guess?
Yeah, so the way we do it, it's actually up to the organizations, right? So organizations get licensing for their hospital and then for their associated facilities that are providing healthcare. And so what the Joint Commission does is we survey a hospital and I'll call it appurtenant facilities based on if they fall under the CCN or the CMS licensing number or certification number of the hospital. So a lot of organizations I worked at, for example, we'd have a hospital and then all the local or regional, if it was ambulatory surgical center or a sleep center or a pain clinic, if it kind of reported to the hospital, it then had a requisite CCN number that fell under the hospital. So those would all be considered to be in scope for the Joint Commission to survey those organizations. So if you're a hospital and you have an ASC that falls under your CCN, we would survey it, and it would be surveyed under the same Accreditation 360 standards in 2026 that the hospital would. But of course, from a life safety code perspective, we evaluate the buildings based on their occupancy. So if it is an ASC, most likely it's going to be an ambulatory occupancy per NFPA 101, and we would evaluate it based on chapters 20 and 21 of the life safety code based on that occupancy.
So if it's an ASC that is not under the CNN, what's the situation with that?
Yeah, so for ASCs that don't fall under the CCN of the hospital, or they might be standalone facilities, so we have a different program for those that's called the Ambulatory Healthcare Program, or the Ambulatory Healthcare Certification for accreditation. And so when we'd survey a site like that in 2026, that program is not changing. So they would still have the EC and LS standards and all the other clinical standards applicable to them until that chapter and program is updated as well.
And I'm not going to ask you the question, when do you expect that chapter to be updated?
Please don't.
You get enough, and it's the headline out of that is if you're kind of that standalone, not under the hospital license CCN, you continue business as business is done. Correct. Until such time you hear otherwise.
Yeah, which of course there'll be an announcement, an update similar to how we did with hospitals and with critical access hospitals.
So Jim, what is it? I kind of as you're talking, I'm just thinking it's a huge. You alluded to it earlier. I think it's like a huge project management. Forget what you're. It's just a huge project management task on the point of the Joint Commission. Can you talk a little bit about a little part of that? The instructor training. You guys must be rolling your surveyors through now, just getting them up and training. What should a hospital who's being surveyed early on, what should they expect out of this surveyor? And when I say that, I guess, I mean, it's not changing, right? And you've made that very clear, but yet your guys, there's still is it a nomenclature change? Is it a...
Yes, I think the survey process. So if you went through a surveyor in 2020, 2023, and you're going to go through one 2026, in terms of what happens, like the agenda is going to be the same. As we talked about, the tools are all the same. The surveyors will be working off those tools and providing them to the organizations. Like that's really going to look very, very the same. Really, the only thing that's going to be different for the organizations is what the report looks like. Like, to be honest, that's really the difference, is the survey report. So what we need to do from a training perspective is obviously teaching everyone what the new standards are, showing them how this stuff all crosswalks. And then we're working on training the surveyors on how to write the new observations in the new standards. And again, a lot of this it's just a change of the existing process, right? Because we're still doing the survey process. We're still evaluating all of our life safety features and the physical environment features of the buildings, and we'll be scoring the same things, but they're just going to go into a new location now. So there's just a kind of a change management training that has to occur, if you will.
The normal time it took to survey your hospital, there's no additional time added on. It's the same. It's the same time commitment.
Same time commitment, same. We call it the survey complement. That's the number of surveyors and the number of days they're on site. As we've discussed, and people have probably heard me talk about this a lot if I've come to your regional meetings, is we have had changes at the Joint Commission to the survey process for offsites and for hospice. And I talked about these at the ASHE conference, and Tim and I are talking about these as we go along. And there's been memorandums released about this. And so there have been some changes that have occurred prior to Accreditation 360 coming out that have impacted the survey complement. So, for example, if you have a inpatient hospice building that's located remotely from your hospital, you'd probably have an extra life safety code surveyor on site for one day to evaluate that building, as per our new hospice process for evaluating those inpatient deemed facilities. And then we have our offsite survey process that went live back in July, where we are now evaluating the offsite locations that our clinical surveyors are evaluating. So that has created some changes to our survey complements. But Accreditation 360 is not going to impact any of those things at all.
Okay. Can I go back to, I wanted to ask, just going back to the competency assessments, you guys are not required, or the organization does not have to demonstrate that the hypothetical facility director meets the job description. They just have to document that they meet the job description.
Can you give me an example?
So CHFM certification, 5 years experience, and college degree required. So, and say, sometimes, especially at these smaller critical access hospitals, those job descriptions can be like jack of all trades, where they're throwing everything in there, requiring a license. Say it's a licensed electrician. They don't have to quantify. They just have to show that their director has 5+ years. They have their CHFM. They've got their licensure, and they have 5+ years experience. They don't have to document that they do those things in a what's the word I'm looking for? In a competent fashion. They don't have to demonstrate their work. Now, I guess you could say you'd probably see that in the survey process. So maybe I just answered my own question.
So I guess kind of break that down into two pieces. So what we look at as a surveyor is we would ask for the job description, evaluate what it says is required versus what's recommended or what's excluded entirely. We'll ask for documentation that shows. So if it says they have a college degree, then what I'd expect to see is either their resume, or maybe they have a diploma in their personnel file that shows that they have that degree. If it says they have to have a CHFM, for example, we'd ask to see the license or at least the license number so we could look it up. So we'd have to validate those things. In terms of like it sounds like you're getting more towards like evaluating the competency, like
Yeah,
in
exactly.
person.
Yes.
Yeah, that's kind of going to be done based on how compliant the organization functions, and getting an assessment of the involvement and oversight that that facilities leader is demonstrating at the organization.
Yeah. It's just such an interesting environment. I know that you guys are tracking questions, and I know that you
Yes.
want questions,
Yes.
especially during these early periods. Can you talk about that? What you are not seeking, but what, if people have questions, what would you like them to do? How do they do it? How do they see the answers? Explain that process, please.
Sure. Yeah. So I did forget to mention something when I was talking about the pre-publication documents. Is one of the other resources we recently released, and I'd say recently, but it's probably been about a month now, is we have a frequently asked questions that's specifically dedicated to Accreditation 360. So when Accreditation 360 went live, there was a link to submit questions specifically about Accreditation 360, which is still up. So if you have any, go to our website, go to Accreditation 360 page, and I believe there's several links on different locations that say, do you have a question? Here's how you can submit one. There's also, I think if you go to the pre-publication page, there's a survey you can take, which will also ask, are these resources helpful? And you can give feedback on that as well. And we're using those questions, the feedback, everything that we're getting to build that FAQ that's out. So please take a look at if you have a question. And we've had many, which is great. We've had a lot of feedback that we've used constructively, so we appreciate that and welcome it. We've used that FAQ to respond to a lot of those questions. So please take a look at that. And because more than likely than not, if you have a question, it's probably been asked, and then hopefully it's been answered.
Are there opportunities to collaborate with with Joint Commission as A360 gets rolled out, or input, or is that the question and answer that opportunity?
I'd say that's the best one right now. I do know that, of course, surveyors are on site and organizations try to ask them questions. And the thing you got to keep in mind is the surveyors do have a day job that they need to focus on. And we're cognizant of that. We're trying not to overload them with too much information, right now, as they're trying to maintain their current work process with the current standards, right? So, we're trying to stage the rollout of this process so it makes sense to both the organizations and to the surveyors. So that's one of the things I might caution organizations is don't ask questions about A360 to the surveyors, because they might not be the best resource, because there's a lot of information that's out there, and that's why we put all these resources online. That's like your source of truth to try and get to what's going on, because like any company, we have a lot of different departments, and the surveyors are doing their day job, and then we've got a whole department that's dedicated to managing the new standards as they come out.
It's like anything. I mean, there's refinements. You try, you do your best, and it's like a construction project. You open for operations, you find things that, oh shoot, we missed it. It's probably very similar. It's a project management.
Yeah, and the other thing I'd mention, and I think Tim and I, we try to focus on the collaborative survey process is very important to us. At the end of the day, we're trying to make sure these healthcare organizations are providing the safest environment possible, but we're also trying to be a resource to organizations towards that. And providing lots of education and understanding and kind of the why things are out of compliance, why things have to be the way they are. I know that's one of the reasons a lot of our surveyors do this job, is they like to have that collaborative element with organizations. And so we are, of course, looking for opportunities on that. So if there are ways that organizations think we can be more collaborative on this Accreditation 360 process, we're working towards that. I think we've done in my humble opinion, I think we've done a really good job of trying to provide a lot of resources in this time frame over the 6 months before the rollout's gone live with the webinar. Like, the webinars are great. There's a base camp that's coming out in a month that I'm teaching along with one of my SIG colleagues that's going to cover A360 and the new standards. I'm sure there'll be more other periodicals, perspectives, EC News that's coming out. And actually, I know for a fact there are some that are coming out about that. They'll be talking about PE. So we really are trying to focus on getting as much messaging out as we can about it in hopes that it reaches as many people as possible from our accredited organizations.
Yeah, you can't really ever over communicate, right? No matter what you're doing,
Right.
and no matter how much you communicate, there's always going to be somebody who you should have communicated more. So yeah, absolutely. Two quick questions, Jim. I know we're up against it. The first question was, is there anything that I didn't touch on, that we didn't touch on, that I didn't ask about that you think is important to just get out there?
I don't think so, but I think I'll just reiterate, like, the big takeaway here is the standards are changing, the survey process is not. So if you had a successful survey, in your last triennial cycle, and you've maintained your evidence of standards compliance, and you're doing your rounding, and you're staying on top of the code requirements and what was required historically, you should expect to have a successful survey again in 2026, because the overall process is not changing. And that's, I think, the biggest and most important message I want to make sure that everyone has.
Yeah, no, that's great. And for a person like me who's always looking to kind of shortcut the learning process, I really like that disposition report that you got. Yes. I mean, that's a sounds like it'll be a great tool. And my second question, the hardest question of all, are you taking a vacation between now and January 1st?
I'm going to try to in November, but we'll see. We shall see. There's a lot. It sounds like a lot of time between now and Christmas and New Year's, but in reality, I don't think so.
Yeah, no, it's really not. I'm not really trying to tell you anything.
Yeah, and I keep looking at my calendar, and it just keeps filling up as we get into the year. But I'll try to take a little bit of time to relax. It's I will say though, it's been a great collaborative effort on this end as well. Working with the surveyors, working with my fellow field directors, and working with the standards interpretation team where I came from, and so it's been a positive environment where we're working together to get this all worked out with everybody. So,
I'm sure you have lots of meetings to begin with. This must be like meetings on steroids, especially as you get closer to that date. I can't imagine what that's like.
Yeah, it's a lot of touch points between a lot of different departments because there are a lot of pieces moving. But I do think it's a testament to this organization that we're making it work. That the people are putting the time in and collaborating so well with all the different pieces that are moving. So in some ways, it's kind of impressive, as well as it is daunting, I guess. When you're rolling out new stuff like this. But it's seriously, it's impressive to see it all happen, and it's a great group of people that I work with. So I'm very proud of this team.
That's awesome. So Jim Grana, Field Director, Joint Commission. As always, I appreciate your time. I wish you and your colleague Tim Markajohn and everybody at the Joint Commission the best as you guys roll this out. January 1st, 2026 is that date.
Yes, sir. Thank you so much, Pete. It was great talking to you.
Jim, always great. Thank you so much. This is
Take care.
Peter Martin for the Healthcare Facilities Network. Thanks for watching. We'll be back with another episode very soon.
If you want to be a guest on a future episode of the Healthcare Facilities Network, go to healthcarefacilitiesnetwork.com and let us know who you are and what you want to talk about, because together we can solve this critical aging issue.